All right, everybody, get ready for this. We are diving deep into this transforming episode accountability model team. Everyone in healthcare is talking about this new CMS thing. Imagine hospitals and patients all on the same side, working together so everybody has better outcomes and fewer of those financial, surprises.
Yeah.
That's kind of the whole vision with this team thing. And we've got tons of sources lined up for you today. We got articles breaking down all the nitty-gritty details, some opinions from experts on both sides of, everything, and even some of those FAQs from CMS to try to clear up the confusion. So what's the game plan? What are we going to do in this deep dive?
Well, I think we should give you a nice, clear view of what team is, no bias here, how it works, and what it might mean for healthcare in the future. And we won't pick sides. No. We'll unpack the whole thing about mandatory participation, for hundreds of hospitals. We'll explore those financial risks and rewards that everybody's talking about. And we'll also zero in on 5 common surgical procedures. You ready to get into it?
I'm ready. Okay, so inning number 1, what exactly is team?
Well, TEAM, the Transforming Episode Accountability Model, is, like CMS calls it, it's basically a new way to pay hospitals for certain surgeries. And it's not really optional, no. Certain hospitals, they have to participate. And it's episode-based, meaning the payment covers the entire journey, the patient's journey for that surgery, not just the time in the hospital.
So it's kind of like a bundled payment, a package deal, covering every base from pre-op to post-op.
Yeah. It covers everything from the initial surgery to 30 days after the hospital. Think about the costs for inpatient, outpatient services, physician fees, rehab at a skilled nursing facility, maybe at home, even things like readmissions, medications, lab tests, and any equipment, durable medical equipment the patient might need.
Wow, that's a lot. It's a whole playbook, right?
Yeah.
So it's like a single price tag for that whole surgical experience.
Yeah, that's the idea. And the procedures team covers are really common, probably ones you've heard of. Coronary artery bypass grafting, CABG, lower extremity joint replacement, LEJR, surgical hip and femur fracture treatment, SHFT, spinal fusion, and major bowel procedures.
Okay, so some big ones in the surgical world. Any exceptions to these procedures?
Yes. Certain conditions are excluded. It's like those players on the injured reserve list. It's ongoing cancer care, transplants, and trauma, but not related to the initial surgery.
Got it. So we know the game, we know the players. Who's got to play? Who's on the roster for this mandatory team thing?
Well, the focus is on hospitals in specific regions, 188 specific geographic regions across the U.S. You can think of it as having different leagues, but they're all playing with the same rules. So the goal is to get everyone in those regions, working together, improve care coordination and outcomes.
I was reading that that's a potential impact of over 700 hospitals and like 200,000 cases. That's a lot of players.
Absolutely. But not all hospitals have to play this game. Maryland hospitals, they have their own rules. They are not included in team. And critical access hospitals, they're not playing either.
So a few players sitting this one out, but I hear there's a way that some hospitals can opt into team, even if they're not in a mandatory region, right?
Yeah, that's right. If a hospital's already familiar with this type of payment structure, maybe they're already in a similar league, like the bundled payments for care improvement in advance model, or the comprehensive care for joint replacement model, they can join team, even if their region's not mandated. It's a way for those who are fine with this approach to keep it going, keep the momentum.
All right. Players are lined up. We've got the plays in motion. Now let's talk money. How does this whole bundled payment system work? Like, does CMS give hospitals a set price for each procedure?
Well, it's not really that simple. It's like if you were buying a car. The target price under team, that's like the MSRP starting point, but there are all these adjustments, like the hospital's characteristics, the patients, and their health conditions.
So no two hospitals, no two patients have the same target price. It's more like a custom calculation for each.
That's a great way to put it. This is why hospitals really need to understand their own data. CMS, they set these target prices regionally, so your benchmark is the average cost for procedures in your area, and they're looking at the size of the hospital, whether it's a safety net hospital, serving low-income patients, and even patient things, age, conditions, social factors.
So CMS is like making a personalized price tag for each surgical episode based on a bunch of variables. Sounds like a lot of number crunching.
Oh, yeah. And there's another thing, a fixed discount on the target price. That changes based on the procedure. Like CABG and major bowel, they've got a 1.5% discount. But procedures like LEJR, SHF, FT, and spinal fusion have a 2% discount.
Interesting. Sounds like they're trying to get hospitals to be efficient
Yeah.
with that discount.
Okay.
Okay. So we've got this target price, it's already adjusted, and then the hospital, they either deliver care under budget or
Yeah.
they go over, right,
Yeah.
like a budget in fantasy baseball.
Yeah.
You either have money left or you're in the red.
You got it. You're trying to beat the average cost for your region. So if a hospital does the care for less than that target price, they might get paid by CMS, a reward for being efficient. But if they go over, they might owe some money back.
Wow. High stakes. How much risk are we talking here? Could a hospital, could they really face big losses under team?
Well, that's where these tracks we mentioned, they come in. They determine the risk, how much reward you get.
Okay, let's talk tracks.
So think of tracks like levels in a video game. Track 1, that's the easiest level.
Yeah.
No downside risks, so hospitals can't lose money, but they can only gain up to 10% of the target price. That's open to every hospital in the first year. And safety net hospitals get 3 years in this track. Gives them more time to adjust to the game.
Okay, so track 1's like dipping your toes in before jumping in the deep end. What about track 2?
Track 2 gets a little more competitive. It's got a 5% downside risk and a 5% potential upside. So hospitals could gain or lose money based on their performance. This one's available in years 2 through 5 for certain hospitals like rural hospitals, safety net hospitals, and others who qualify.
Okay, a little more risk, a little more reward. And then track 3, the expert level.
That's it. Track 3 is for hospitals that are ready to, well, swing for the fences, available to all hospitals the whole time, and has that 20% downside risk, but also a 20% upside.
Those are big numbers. So hospitals really got to understand their data, their resources, how much risk they want to take before they even pick a track.
Yeah, absolutely. But it's not all about the money. Quality matters in team, too.
Yeah, you can't just try to save money and forget about giving patients the best care.
Right. The quality of care directly affects how much hospitals earn or owe back under team, like getting bonus points for good sportsmanship.
I like that. So how does CMS measure quality in team?
They look at 5 key things: hospital-wide readmissions, patient safety incidents, falls with injuries, rates of post-operative respiratory failure, and the 30-day death rate.
Wow. Okay, serious stuff.
Yeah.
So hospitals got to hit home runs in cost savings and quality of care?
That's the game plan. All those quality measures, they're combined to make a composite quality score. That's the CQS. That score is applied as a percentage adjustment to the hospital's final payment. High quality, that boosts savings or reduces repayments. Low quality, it can mean less money back or even higher repayments.
Tools like getting extra points for a grand slam or penalties for a bad call by the umpire really pushes hospitals to focus on quality.
Yeah, it does. And here's another thing. Hospitals could get penalized for poor quality under team and other programs, too, at the same time.
Double whammy.
Yeah.
Raises the stakes even higher for hospitals to get this right.
And there's some debate about how they measure things. Some experts say these measures, they're not really specific to the surgical episodes, and that patient-reported outcomes, how the patient feels and functions after surgery, that should matter more.
Yeah, it makes sense. At the end of the day, what matters is how the patient's doing. So this whole team model, it's a whole new ball game for hospital.
Oh, it is. And that's just the first inning.
So what are some things that hospitals can do to get ready for this? What are some practical steps?
Well, you can't cram for this. You have to change how care is delivered, and that takes time and planning. First, hospitals have to really understand their data, benchmarking, comparing themselves to regional and national averages for cost and quality. It's really important. They need to know where they are and where they can improve.
Like scouting the competition, watching game tape, see what's working for other teams.
Right. And then it's about redesigning care, streamline processes, standardize stuff to reduce variation, and really tighten up care coordination for the whole episode.
So making sure those transitions between the surgeon and the rehab, for example, are smooth, that everybody's on the same page.
Exactly. And managing that post-acute care is another big part of the plan. Hospitals need to partner with skilled nursing facilities, home health agencies, and other providers to make sure those transitions are smooth and the patient recovers the best way possible.
Got it. And it's not just about systems, right? People have to be okay with this new way of doing things.
Very true. Engaging physicians and staff is critical. You got to get everybody to buy into this team model, align their incentives, and give them the training and support they need to adapt and do well.
I bet technology is a big part of this.
Oh, yeah. Using technology and data analytics is critical. That's how you track performance. You identify um, areas for improvement
Yeah.
and make decisions in real time based on the data.
Yeah.
Using information to make care better.
Like having a high-tech coaching staff that can analyze the game and suggest adjustments as you go. And we got to remember health equity.
Yeah.
Team has to work for all patients, no matter who they are or where they come from.
That's an important point. You got to address health equity and the impact of social determinants of health. That's fundamental. Hospitals need to make sure everyone has access, equitable access to care and resources, and work to reduce those disparities in outcomes.
So team's not a single game. It's a whole season in healthcare with different players
Yeah.
and strategies, wins and losses.
Yeah, it's not a quick fix. It's a fundamental shift in how we approach healthcare and how we pay for it. We're all in this together, hospitals and patients. Yeah, it's definitely a shift. And like any game plan, got to understand the money. One of the biggest things in team is how CMS figures out, those target prices for each episode of care.
Right. We talked about target prices earlier, but I think it's time to dig in a little deeper. Those target prices, that's really the whole foundation of the system, right?
It really is. It sets the stage for everything. If CMS messes up those prices, it could give some hospitals an advantage or make it, well, basically impossible for others.
And CMS is using all this data to get those prices right. They start with costs at the regional level, don't they?
That's right. They look back at 3 years of Medicare claims data, see what those 5 surgeries have usually cost Medicare in different parts of the country, and they divide the country into 9 regions, census divisions. It's like dividing a baseball league into divisions based on how the teams do.
Okay. Makes sense. You wouldn't want to compare, a big urban teaching hospital with a small rural hospital. Different leagues, different resources, different challenges.
Exactly. And CMS takes that into account. With the target prices, they don't just look at the total cost, they break it down by DRG. Those are codes that classify patients, put them in groups based on their diagnosis and what procedures they have.
So it's like putting players, categorizing them by position and skill level.
Yeah.
You wouldn't expect a rookie pitcher to get paid the same as an all-star.
Right. And a big hospital with a lot of complicated cases might have a higher target price than a smaller one.
Location, size, complexity. What about the patient's, their individual health? Someone with lots of chronic conditions, that's going to be a more expensive surgical journey than someone who's healthy, right?
Definitely. CMS uses a risk adjustment model to account for those differences. They look at age, how many chronic conditions the patient has, and even things like socioeconomic stuff that might affect their health, their recovery.
Not just the surgery itself, but the whole patient, their health. How likely they are to need more care.
That's it. They even factor in whether the patient lives in a medically underserved area, which can affect access to care and costs. Dual eligibility, Medicare and Medicaid, gets pretty complex.
So they're making like a custom price tag for each patient having these surgeries. How do they handle all those numbers?
That's where the CMS statisticians come in. They've got these algorithms, they're sophisticated to process all these variables, and they come up with a risk score for each patient. Then that's used to adjust the target price.
Like a moving target, always changing based on the patient in the hospital.
Exactly. And then remember that discount, 1.5% or 2% depending on the procedure. CMS does that to push hospitals to find ways to be more efficient.
So even with all that data, they still want hospitals to find better ways to do things, more cost-effective approaches.
Oh, yeah. And that's what makes it interesting. Now, hospitals, they got to look at their own data, compare themselves to those benchmarks, figure out where they can improve, be more efficient without messing up quality.
It's not just about cutting costs. It's got to be smarter, more innovative ways to do things, maybe reduce unnecessary tests, or maybe it's improving the transitions to post-acute care.
Exactly. And it often means preventing readmissions. Those can really cost a lot. It takes a team, surgeons, nurses, case managers, PT, everyone, to find the best, most efficient way to take care of each patient.
I'm guessing technology's got to be part of this, right?
Yeah.
Hospitals are probably using data analytics more and more to make sense of it all.
Data analytics is a huge tool in this new world. They're using software, it's sophisticated to track costs, watch the quality metrics, identify patients who might be at risk for complications, even predict potential problems before they happen.
Like a high-tech coaching staff,
Yeah.
analyzing the game, suggesting changes to the plan as they go.
Yeah, that's a good way to think about it. It's not just about reacting to stuff when it goes wrong. It's about preventing those problems. Some hospitals, they're using telehealth, for example, to watch patients remotely after surgery. That helps catch things early. Avoid those readmissions.
That's pretty smart. Sounds like this focus on data and care coordination, it's changing how hospitals work with other providers.
Oh, it is. Team is pushing hospitals to think beyond just themselves and work better with skilled nursing facilities, home health agencies, rehab, and even primary care. They're realizing they need a good network to really get the best outcomes for patients.
It's like realizing you can't win a championship without a good farm system and a whole network of coaches and trainers helping the players.
That's it. Team encourages integrated care networks, all the providers working together smoothly to give coordinated, high-quality care. It's not about competition. It's about working together.
So less about individual players, stealing bases, more about the whole team working to score runs.
I like that. And this new way of thinking, it's changing healthcare. Hospitals are getting incentives to invest in preventative care, keep patients healthy and out of the hospital in the first place.
Like the best way to win is to stop the other team from scoring at all.
Yes. Team wants the whole system to be more proactive, focused on the patient.
Fascinating stuff. But I got to say, it's complex, too. A lot for hospitals to get used to.
Definitely. A lot of hospitals are they're having trouble keeping up with team. They're investing in technology, retraining staff, changing how they do things. And they got to do it all while still, taking care of patients every day.
Like asking a team to switch sports mid-season. There can be some growing pains. I bet some hospitals are doing great while others are still trying to figure it out.
You're right. Some hospitals were already ready for this value-based care. They had the data stuff, the care coordination, good leadership from the physicians. They were already doing it. So when the rules changed, they were ready.
Like a team that's been practicing hard, primed and ready to win. But for others, it's tougher. A lot to learn.
Right. They might be struggling to get the data, make sense of it, get physicians involved in the redesign, or build those partnerships with other providers.
Some teams celebrating, others fumbling the ball.
That's it. And that difference, it's causing some tension, some anxiety.
It's got to be a lot of pressure.
Yeah.
Hospitals are worried about financial penalties, their reputations, and most importantly, the care they give to patients.
Absolutely. And here's where it gets more interesting. Because team is 5 years, things are going to change, people will adapt.
Like watching a team develop over a whole season. There'll be mistakes, they'll learn, and hopefully steady progress.
And we're already seeing that. Hospitals are sharing what works, developing new care models, finding new ways to use technology to improve, like watching those game tapes, scouting, getting better to stay ahead.
Dynamic process. Everyone's learning as they go. I guess CMS is part of that evolution too, right?
Definitely. They're helping hospitals fine-tuning the payment stuff based on how things are going, even thinking about adding new ways to measure quality that show patient outcomes better. Like the league, they're adjusting the rules as they go to make it fair, encourage improvement.
I'm getting a sense of excitement and uncertainty around team. Nobody knows the final score, but everyone's watching to see how it changes the game.
It's a big moment for healthcare, and we got to remember we're all part of this, not just hospitals and policymakers, but patients too.
And that brings us to something crucial about team, the financial risks and rewards for hospitals. Time to talk about those reconciliation payments and penalties. All right, we've talked a lot about this, but what's the bottom line? What's it mean for hospitals financially under team?
This is where, where the rubber meets the road. Remember that target price? Well, after everything's done, there's this reconciliation. Hospitals find out if they, if it came in under budget or over.
Like settling up after the game, seeing who owes what?
Yeah, exactly. If the hospital's total cost for a surgery goes over that price, that target, they're in the red. Got to pay CMS back for some of those costs.
Like going over budget in your fantasy league?
Uh-huh.
Got to pay the commissioner.
Right, but if they keep costs under that target, they're in the green. Might get a payment back from CMS.
like finding some extra cash in your fantasy budget.
Always nice.
But what about those quality scores? Those matter for the payments too, right?
Oh, absolutely. Those scores can make the savings bigger or the retainments bigger too. A high composite quality score, that's CQS, it can boost the savings.
Yeah.
But a low one means less money back or even more to pay back.
Can't just pinch pennies. Got to give good care if you want to come out ahead.
Right. You can't just cut corners. Might end up costing you more in the end. It's about finding the right balance, efficiency and quality.
Like a balancing act.
Yeah.
Money and patient care.
And that's where choosing the right track matters. Track 1, remember, that's the safest one. Hospitals can't lose money, but they can only gain so much. Playing it safe, low stakes.
Then there's track 2, a little more risk, a little more reward, 5% either way.
Yeah. That's where hospitals, they got to think about how confident they are. Can they manage costs and quality? Ready for a tougher game.
And track 3, the high stakes one, 20% gain or loss.
Like the championship game, right?
That's it. The track, it shows the hospital's strategy, how comfortable they are with risk.
Interesting. Some hospitals playing it safe with track 1, testing things out. Others, they're jumping right into track 2, even track 3.
It's all over the place. Going to be interesting to see how these strategies work out.
So big picture, what are some of the key things we can take away from TEAM so far? Well, TEAM is definitely making hospitals rethink how they do things. It used to be fee for service, paid based on how much they did. Now it's value based, rewarded for efficiency, for quality.
So it's not about filling beds; it's about keeping patients healthy, out of the hospital.
Exactly, big change in how we think, and there are definitely challenges.
What are some of those? What are people worried about with TEAM?
One big one is health equity. People worry that hospitals might start avoiding patients who are sicker, more complex, the ones who are more likely to cost more and hurt their financial performance under TEAM.
Like a team benching their best player because they're worried about their batting average.
Right. Not fair, not ethical. CMS, they've tried to fix this. They adjust the target prices for hospitals that see more low-income patients with complex needs. But some experts say it's not enough. They say we got to do more to make sure all patients get the same high-quality care. It doesn't matter who they are, what their health is like.
So that's something to watch, that equal access under TEAM. What else are people worried about?
Well, the model is just, it's really complex. Those calculations, the risk adjustments, the reconciliation, it's a lot to understand. And some hospitals, especially smaller ones with fewer resources, they're having a tough time keeping up.
Like trying to learn a whole new playbook, but with no practice.
Yeah, and this difference in resources, it could make things worse. The gap between the hospitals that are already doing well and the ones that are struggling.
So having the technology, the data experts, even just the money, that's going to be key for hospitals to do well with TEAM.
Absolutely, and that's where working together, partnerships, they become even more important. Hospitals need to share what they've learn from each other, and combine resources to deal with this new world.
So even though it's competitive, everyone wins if they work together to make things better.
Exactly. TEAM is making hospitals think less about winning by themselves and more about, the good of everyone.
Not just a new payment model. It's a whole new way of doing healthcare.
I think that's a great way to put it. It's about moving towards a system that values being efficient, giving good care, and putting the patient first.
Big goals. And there are going to be bumps along the way.
Oh, of course. But there will be breakthroughs, new ideas, and a sense that we're all in this together as we try to make healthcare work better for everyone.
And that's what makes it so interesting. We're seeing this huge change in healthcare, and we're all part of it.
We are, and I think the most important thing is to stay involved, keep asking those questions, and be curious and optimistic about this change.
Well said. Team's changing the game, and it's a game worth playing. Thanks for joining us for this deep dive. Hope you learned something, and maybe even feel like getting involved in shaping the future of healthcare.